I'll explain it how I explain how we get people numb and comfortable is that we use a machine called a wand that uses pressure to anesthetize, to give the anesthetic. You know, traditional ways we use a syringe with a big needle and we come in and we try and inject and hold that steady, and it hurts. It doesn't matter what we do. You know, but what we do with with the wand is we go in and there's a small needle cannula on the end of it, but it uses a lot of pressure at the end to infiltrate anesthetic. So in many cases, we're putting just the flat end of that little cannula on the tissue, and it will actually infiltrate and bubble up that tissue. And so once we do that, sometimes they'll feel a little pressure at first as it does that, but once we do that, there's no pain because it's anesthetized and numbed that whole area. It does it very quickly, efficiently, and without pain. The other aspect is you don't get that kind of that emotional kickback from seeing a syringe or a needle or knowing you're going to get stuck with a needle. It's a different process. I've been using it for 10 years. It's a very different tactile feel to it, the way we do it, and there's a learning curve for dentists to use it. So there's very few dentists who use it because they just don't want to take the time to learn how to do it. But for comfort levels, there's nothing beats it as far as getting people numb, and most people don't even know that we're getting a numb sometimes until they go, wow, I'm numb already, I can't believe that, and I didn't feel anything. Technology can benefit the guests so much because it makes what we do better. If I didn't have a laser, I'm so reliant on that carbon dioxide laser because I use it for almost every procedure in some way, a small way. You know, I had one day where the laser didn't work and I panicked because I thought, well, I can still do this, but I can't do this as effectively and as well, and is my pain going to be as much? And luckily I was able to get the laser shipped out the next day, the new one, and so I didn't go without it long. But I really rely on those kind of things, especially technology that works. I mean, there's so much technology, sometimes you have to kind of wait and see which one or how it's really going to play or how it's going to play into what you do. But you know, the technology that I've invested in, you know, I'm a big believer in because I know it makes things better. It makes pain better. It makes what we do better. I mean, can we do things without a laser? Yes, we can, but can I do it as well? No. 3D imaging, if I want to place an implant in a very complicated case, can I do it without it? Yes, I can do it well without it, but can I do it better with it? Especially in places I have hard time vision. Yes, I can do it better. So it just makes what we do, takes some of the guess out of what we do, and it truly can make things better for the patient sitting there. Scanning, 3D imaging, CAT scanning or CAD cam. You know, the impressions are so accurate. We don't have to put temporaries on and get people numb twice and have them come back, or come back several times to rematch shades because they don't work. You know, we can do that all in one appointment now and do it even better in one appointment because the impression is so accurate. You know, when we take an impression, it's kind of like taking a copy of a copy. With 3D scanning, 3D imaging, you know, we can 3D. I keep screwing this up, but 3D CAD cam. With CAD cam, we can take a very accurate impression, so we don't have to remake an impression and pour up models like we traditionally do.